a woman that had been coming to the clinic for her antenatal. When she started having issue, she was telling them to bring her to the facility. They were telling her is a spiritual thing, which is that pre-eclampsia.
Okay.
She was having dizziness, she was fainting, she was convulsing, and they were giving her some other things at home. But at the end of the day, they had to rush her to the facility where we work. And our facility is a primary health center. We don't care for eclamptic cases.
Thank you for joining us. Let's start with an introduction. Can you tell us your name and what you do and how long you've been a midwife?
Okay, thank you for having me. My name is Mrs. Alice Adagam. I'm a registered nurse midwife. I work with the area council as a nurse in the primary health center.
Okay, so how long have you been a nurse midwife?
Yeah. I did my nursing. I graduated in 2021. And then after that, I went for my post-basic midwifery, which is a specialty, in 2015. So I've been practicing as a nurse from 2021 to date. 24 years.
24 years. Wow. Okay, so why did you choose to become a midwife? Was there a moment that sparked it? Or?
Yes, after my nursing, I started practicing, but I discovered that I was lacking in that aspect of caring for pregnant women and newborn babies. So I had to go do my specialty as a midwife. I did other courses, but I discovered it was not helping me in the aspect of caring for the mothers and their babies.
Okay, so can you tell us what exactly you do and what does a typical day look like for you?
My day as a nurse midwife is not always certain because anything can happen. Sometimes I will be busy, sometimes I will not, and sometimes I work 24 hours even because the cases do not tell you that they are coming. So you'll be doing one thing and another thing is calling you. So it's not always certain.
Okay. All right. So if you can walk us through maybe the last delivery you handled, maybe from start to finish, what really happened?
Like the last one that happened was the first time mother. She was just 19 years old, and because she's a first time mother, when she started having labor pain, she was just coming to the hospital to check her, and it took us almost 24 hours before she delivered. But it's not that we kept her. Being a first mother, she may not know that it would take long like that, and that was why she was always coming to the clinic. We will check, she will go back and come. So I had to stay throughout the day to attend to her, and it was really a prolonged labor, but at the end of the day it was a success.
Okay, so so far as a midwife and I'll say a caregiver, what is the most difficult situation you have ever faced while helping a woman give birth?
There have been so many situations.
Okay, maybe give us one instance. Can you think of one?
Attending to pregnant mother alone,
Okay.
and sometimes having complications that you have to be running alone in the labor room.
Okay.
Yeah. For example, after delivery she's bleeding, or maybe after delivery you have to care for the baby. You are caring for the mother and at the same time caring for the baby. Sometimes it's always stressful because we are always understaffed in the facility.
Okay. Okay, so this question is going to be more of an emotional one, a one that maybe comes very close to you. Have you ever lost a mother or a child? What happened and why?
Okay. Losing a mother, I have not had any, but for the babies, I have. But mostly it's not because we didn't care. It's because of what happened at home before coming. Sometimes the mothers don't come to the facility. They always try staying at home to see if they can deliver. Prolonged labor and obstetrical labor can cause so many things. The prolonged labor may make the baby to die, whether in utero or immediately after delivery. You can even have a baby breathing in the womb. 10 to 15 minutes to delivery, the baby will die. Or even after delivery, if care is not taken.
Wow. So, what are the most common complications that you deal with during deliveries?
Okay, the common complication we have in our area, postpartum haemorrhage. That is the woman bleeding after delivery, and it can be so many causes, so many. So we are trained to take care of that. The second is pre-eclampsia. That comes with high BP, that's high blood pressure, and protein in urine. We also take care of that. It's an emergency care that the midwife is trained to take care of.
Okay. So, as a midwife, what is the most heartbreaking story or encounter you have had as a midwife?
As a midwife, the one I cannot forget is a woman that had been coming to the clinic for her antenatal. When she started having issue, she was telling them to bring her to the facility. They were telling her is a spiritual thing, which is that pre-eclampsia. She was having dizziness, she was fainting, she was convulsing, and they were giving her some other things at home. But at the end of the day, they had to rush her to the facility where we work. And our facility is a primary health center. We don't care for eclamptic cases. We refer them for surgery. She ended up going for the surgery, losing the baby and having surgery. It's heartbreaking.
Wow. So you said eclamptic cases. What is that?
Yes, pre-eclampsia and eclampsia. Pre-eclampsia is leading to the eclampsia. In pre-eclampsia, the signs you see are the BP is high, and then there is protein in her urine. The protein should be 2+ and above. And when it gets to eclampsia, that is when the woman starts fitting. Once she starts fitting, there's nothing you can do except taking her into the theater and operating her to get the baby alive and the mother alive.
You talked about something about this last case you just talked about that has to do with belief and spirituality. So, which leads me to my next question. What are some dangerous practices or cultural beliefs that people have there that put women at risk?
We have so many, and those are the issue we have in the society, their belief and their cultural practices.
Okay.
Some believe that for a woman to have successfully given birth to 2-3, she can easily deliver at home. But not knowing that every pregnancy comes with its own complication or with its own presentation. And then some, it is cultural belief. We believe that if you go to the hospital, you are not strong or somehow. And then some, they have the cultural behavior is a man will be the one to give you permission to go to the hospital before. Like in that case, the husband was not around
to give the permission
to take her to the hospital.
Wow.
So those practices are making the women to either lose their lives and or their babies.
Okay. So now, what's talking about how to make things better now? What system or support would make your work more easier?
Okay. Making my work more easier, especially in the facility, is having more staff. And also having all the equipment we need for work, because sometimes we improvise, especially in the primary health center. We don't have all that we need. And then also, as a midwife, midwifery is a specialty. Most governments don't reward us or pay us our specialty allowances.
Wow.
And it's making you know what is happening, discouraging the JAPA thing. When you get there, you know you are paid better than you are paid here in the country. So if they can look into it, and also the training. There's something I was thinking of. If our communities can come together, put money, and train somebody in every community to be attending to these mothers, especially facilities. Communities that don't have facilities. If that person is trained and is in the community, she knows what she can handle in that community, and she knows what she can refer to the facility.
So the person becomes like the first contact person in case of any emergency. Have you ever had to improvise during delivery because equipment was not available?
Several times.
Wow.
Yes, several times. I remember I had an asphyxiated baby. A baby that comes out and could not initiate breathing. You will see that this baby is alive, but it cannot initiate breathing. We have what is called ambu bag, which we can use to pump air, into the baby, and the baby will initiate breathing. So not having that, I had to improvise. Sometimes I use face masks, put it on the baby's face, or I use several things, gauze. That is improvising. Like I was taught that without the oxygen, the oxygen cylinder, your breath is what is the oxygen you can give to the baby before the baby can get the real oxygen.
So now, if you had 60 seconds, I know 60 seconds will not be enough to say all you would have to say, but if you had to just go straight to the point, 60 seconds with the Minister of Health, what would you ask for urgently?
If I say massive training of midwives, it will look somehow. If like what is happening now, if you massively train them and you don't employ them or you don't engage them, what will happen? They will go to where they are needed. So if you can massively train and also employ them in every level of health, that's the primary, the secondary, and the tertiary level, it will go a long way.
You talked about being old. being old, your allowances, don't you think if something is done towards that direction, maybe better pay and
Not only being
allowances?
old, specialty allowances.
Okay.
Like as a midwife, since I started practicing as a midwife, I don't think I've been paid specialty allowance.
Wow.
But for we have different branches in nursing.
Okay.
We have the Aston and emergency nurse, we have the intensive care nurse, we have the pre-op nurse.
Okay.
They are well paid.
Okay.
They are specialty allowances. But for the midwife, that has been neglected for long.
Okay.
Yes.
So I would say training and better allowances.
Yes, training and better, more training.
Okay. So now, as we gradually round up, if you could leave one message to Nigerians and Africans about maternal health, what will it be?
Okay, the message to Nigerians is they should please always assess the facility. Always assess, especially for a pregnant mother that knows she's pregnant. The first thing is for her to visit the clinic and register, and then continue till she delivers, and then she will also be coming back for a postmortem clinic, because pregnancy does not end in the labor room.
Okay.
We've seen where a mother delivers after a week, there are complications that comes up.
Okay.
For a midwife, she attends to a woman from when she's pregnant to when she delivers after 6 weeks.
Okay.
Yeah. And most people don't consider that important. If they can continually from the beginning to the end, it will go a long way.
Okay. All right. So, despite all this, what really keeps you going?
What keeps me going is the joy that I'm always bringing a being into this world, and also making a mother happy. Because sometimes, anytime I hear that a woman is in labor, especially in my facility, I'm always on my toe. Because I know what within the next minute what will happen to a mother if she's not attended to, or what will happen to a baby if the baby is not attended to.
Wow. So that's joy in handing over a baby to her mother.
Yes, and also having a live mother too.
Okay, one last question. What is one thing people misunderstand about midwives?
Okay. Some of the things I think they misunderstand about the midwife, they think the midwife is a spiritual person, she does magic. But they don't know that it is part of the training. We're trained to handle every situation that comes our way. So, and that was why I said, if every community can train somebody within that will be able to do this magic that they think is a magic, to go a long way.
All right, so thank you very much. This has really been an inciting conversation, and it's really good to hear from you, and then as you share your experiences and share your challenges, and then hope that we could get things right and then make the whole environment well equipped and safer for our mothers.